Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and take actions and try and make a better system for all of us. Today we're going to talk about rural hospitals, and they're having a lot of trouble, especially with respect to maternity. Down below, before we start, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which is the text for today's video. You can sign up, click on the link. There's a subscribe button there to the newsletter. You get that for free. And all of the reports and the studies and the analyses and the actions, everything I mention is in that newsletter. Of course, actions will be called out separately as well in the YouTube description box. Okay, let's get started. More than 200 hospitals in rural areas of the United States have closed up shop on labor and delivery services in the past 10 years, according to a recent report. The result? More than half of rural hospitals no longer offer birthing services nationwide. And as hospital expenses increase, patients in rural areas face even greater difficulty accessing maternity care, leading some experts to declare a state of crisis. This is all from an article in the Journal of the American Medical Association online. I will point out that there's also a link to the report. It's by an independent think tank in Washington. The report, and the link is in the newsletter, the report was prepared by the Center for Healthcare Quality and Payment Reform. There are both workforce and financial challenges that they mention in the report. It's actually a pretty well-written report, not too long. I recommend it. In 10 states, more than 2/3 of rural hospitals no longer offer labor and delivery services as of just January 2024, the report noted. And it is based on data from the Center for Medicare and Medicaid Services Healthcare Provider Cost Reporting Information System. And of course, there's a link to that website as well. Some states are way worse than others. No state is good. In Florida, which is the state with the highest percentage of rural hospitals without maternity care, only 3 of 21 facilities outside of urban areas still offer labor and delivery. The gaps in rural maternity care mean that patients have to travel long distances to reach the nearest hospital that can serve them. The travel time to a hospital with labor and delivery services in rural areas is at least 30 minutes, although more often it's 40 or more, according to the report. That's in contrast to municipal areas where it's generally 20 minutes or so. In New Mexico, the median driving time to a hospital with obstetric services, 61 minutes. In Alaska, more than an hour and a half. Mothers and babies can die if they can't get to the hospital and deliver the baby in a timely fashion. Remember that. In fact, increases in maternal mortality and infant mortality are related to the amount of time, in part related to the amount of time the mother has to travel to get to labor and delivery. How did we get here? Well, there are several problems at play. In states that have restricted abortions, OBGYNs are leaving the state. We saw that in Idaho. I reported on that a few weeks ago. They can't attract new OBGYN residents, period. And a large number have moved out of state. I mean, a significant percentage. Not just 1 or 2%, it was over 20. It just isn't safe to practice there. Now, secondly, maternity services are not often a profit center. That means that the staff and the resources need to be available 24/7, but they're not used 24/7, and so it's hard to make them pay for themselves. Since they are not self-sufficient, hospitals just often close them. This is especially the case when a private equity investor takes over a rural hospital, and we've seen this kind of thing over and over again. If you ain't making money, you're out the door. So what are the recommendations? Well, the report recommended that state Medicaid programs and private providers increase what they pay. Well, that's a Band-Aid. That could help it would be hard to get enough money out of them, especially in areas that don't have lots of children being born. That might help some hospitals, but the real issue is that the hospital does not support sufficient births. The real answer is twofold. First, make it safe for doctors to go to work by legalizing abortion nationwide. That'll let doctors feel safe to stay at the job they're at. Second, implement a regional authority to make sure that the infrastructure that the hospitals have is paid for and the hospital doesn't go wanting. That way, hospitals are not dependent on the volume of births, but will have sufficient funds to have staff and facilities available as they're needed. What a concept. This concept has a name. It's called global budgets. And good news, it's part of HR 3421, the vastly improved Medicare for All Act. There is a link to the text in the newsletter, and I refer you to section 611 in the text if you want to read how it works. All right, so let's take an action to try and fix this. Let's let our members of Congress and our senators know about this shameful situation. Let's also remind them that women and babies' lives are at risk in rural areas, and that restoring the right to reproductive health care and implementing universal health care can save lives. Their contact information is down below in the resources section, or the simplest way, you can use RESISTBOT on your cell phone. Just send a text message. The message is SIGN, SIGN, space PSXUFP. Let me repeat this. You send a message to 50409, and the message you send is SIGN, space PSXUFP. And here's what you're going to be sending them. I'm your constituent, and I want you to know about a new report from the Center for Healthcare Quality and Payment Reform. Here's a link to the report on maternal care in rural America. And actually, the URL for the report is spelled out, and hopefully somebody on the legislative staff will pick it up. It is shameful. More than 200 hospitals in rural areas have stopped offering labor and delivery in the last 10 years, and more than half of rural hospitals no longer have birthing services. The more time it takes to get to the hospital, the more at risk the mother and child are. Part of the problem is that labor and delivery is not a profit function. The other is getting doctors to be present. It's a complicated problem, but good news, you can help fix both of them. First, make it safe to be an OBGYN by passing the Women's Health Protection Act, that's Senate Bill 701 or HR 12, so doctors don't leave states that threaten to put them in jail for caring for their patients. Those doctors are the ones best suited to handle high-risk pregnancies. Next, make sure that hospitals have enough money to keep labor and delivery open by offering a global budget that makes sure that their infrastructure costs are covered. That includes doctors' salaries, by the way. That is Section 611 of HR 3421, the vastly improved Medicare for All Act. Look, I know women and mothers and children are important to you. Here's your chance to act like it. Support and pass both of those. Thank you. Thank you for listening. Now down below, you can like, share, and subscribe. You can send me comments in YouTube or at healthcareadvocacy1@gmail.com. You can click on the newsletter link and have these newsletters delivered to your inbox every day. I look forward to hearing from you. Have a good evening.